Now we're delighted to be joined over the telephone by our guest for the afternoon, Dr. Islam Anan, the Health Policy and Health Economics Advisor. Dr. Islam, it's a very good afternoon to you, sir.
Good afternoon. Thank you for having me.
Thank you so much. Thank you so much, Doctor, for your time this afternoon. And let me start by asking you, Doctor, about the Universal Health Insurance System in Egypt, which was launched in 2018. If you could give us a bit of an overview with regards to the main aims and objectives of this system that has been implemented in 6 main phases over the next 15 years.
Perfect. So previously and before 2018, we used to have an insurance system which is not covering all Egyptians, and the health expenditure mainly was out of pocket at 60%. So 60% of the health expenditure was actually coming from the pocket of Egyptians, and that needed to be changed. And President Sisi announced that all Egyptians would have a free insurance system, and hence the release of the new law of 2018. The new law states that we will be replacing the old healthcare system with a new one, which is actually household-based premiums to be cut from the families and underprivileged to be paid by the government on their behalf.
Yes.
And saying that we need to make a lot of reforms. So we had Universal Health Insurance Authority, which is responsible of collecting the premiums and separating that with governance from the service providing bodies. And the service providing bodies, which is the Egyptian Health Authority,
yes,
to take over governorate after governorate. And having said that, the plan is by 2032, all Egyptians to be covered by the new system, which is governed currently, separating the finance of healthcare from the service providing, and the new concept as well, which is the inclusion of the private sector inside the private insurance. So the citizen can has the choice to go to a private hospital or a public hospital, and same fees and the same actual insurance coverage.
Right.
So by that, we'll be reaching at 80% coverage by 2032.
Right. Doctor, let me ask you now, this system, of course, as you said, differs from previous health insurance models. Tell us a bit more about the eligibility of who is to benefit from this universal health insurance system. All citizens, like you said, but does it have specific brackets? Does it have priority to certain citizens in the country?
So for the new system, we do have equity in terms of access. So we have an equitable access for all Egyptians and all residents as well. So even for residents and expats who are actually living in Egypt, they will be having the privilege of having the healthcare system coverage as well, as long as they are paying the premiums every year. And the underprivileged, as I was saying, if anyone under the poverty line, the government will be paying his premium on his behalf. So no discrimination, there is no difference between Egyptians for the new healthcare system, and that's actually what we are aiming for. And in terms of even of quality, we are aiming of having an equitable quality in terms of service provision and in terms of healthcare coverage as well. So any citizen living in Aswan will be having same quality, access, reach as well, same as a citizen living in Marsator, living in Cairo. So that's the standardization the new healthcare system is actually built on. Currently, as you mentioned in the introduction, we covered 6 governorates in Egypt, and year after year we'll be reaching more governorates, and we end with Cairo, which is the heaviest in terms of population, governorates by 2031, 2032, and to close all gaps.
Bit about the stages of the rolling out of the universal health insurance system across the country.
So I have a little disconnection in the line, but if I understood it correctly, we are talking about the rollout of the health insurance system across the governorates.
Yes,
and for that, we started with a pilot governorate. So Port Said was the pilot. And Port Said is actually characterized with very specific healthcare providing facilities, and it's easy to monitor and watch the pilot in terms of learning the lessons before we roll out to the other governorates. The success of Port Said model was actually very encouraging to go for south of Sinai, to go for Upper Egypt as well, like Luxor and Aswan. And currently we'll be going governorate after governorate, as I was saying.
Yes.
And the main lesson from that is preparation of hospitals, which is currently, we do have a specific authority for that, which is GAHAR, which is General Authority for Accreditation and the Quality Aspects, which preparing the hospitals to be exactly the same as standardized between governorates.
Indeed. Now, Dr. Islam, let's talk a bit about the digital infrastructure that is supporting the universal health insurance system in Egypt. This is a very, very important part of this implementation.
Sorry, can you repeat again? I have
yes.
A connection, sorry.
Yes, I'm afraid the connection is poor, but I was asking you about the digital infrastructure that will be supporting the implementation of the universal health insurance system in the country.
So the infrastructure, we always segment that to financial infrastructure, and that will be coming from two things, from the taxation that already actually did for healthcare. It will be coming as well from the costs, which is sugar tax, which is tobacco tax, which will be having a cost for the health insurance. Another one is actually the premiums paid by the citizens who can actually afford healthcare. And then other than the infrastructure or financial one will be having the hospitals. So currently in Egypt, we do have a good coverage of hospitals, but we lacked before 2018 the standardization between the hospital in terms of service providing, in terms of coding, and in terms of treatment protocols, which is now is currently developed to have the coverage of the hospitals with the same standardized treatment protocols. Again, we do have an infrastructure of diagnostics, which is needed between primary care, secondary care, and tertiary care. So currently a plan is actually built governorate after governorate. Any governorate is actually one of the 6 governorates that we launched health insurance. They do have the financials ready, they do have the hospital coverage ready, the diagnostics, and the referral pathways, which is very important. How can we refer it from the primary care to the secondary care? And saying that there is the infrastructure of the technology itself, technological infrastructure. And for that, Egypt implemented a health information system, HIS, which is completely electronized. So we do have the digitalization phase finished for the 6 governorates, so the citizens won't be actually bombarded with a lot of paperwork. There is no transfer of hard copy file between the primary and secondary. It will be all in the system, so it will be actually a paperless system. So that's the infrastructure in brief. Financial and technological and hospital. And of course, the final one is the human resources, which is a big topic in terms of preparation.
This actually leads me to my next question, Doctor, the issue of human resources. What is being done in terms of, training and preparing the human cadres that will be running this whole system throughout the country?
Perfect. So anyone actually living in Egypt will notice that the previous 5 years do have a massive training courses for all healthcare professionals. We do have a specific institute, which is the National Training Institute, and each authority that was actually built by 2080 law, like the Egyptian Drug Authority, the Unified Procurement Authority, and the Universal Health Insurance, they got a training department with a huge lump sum going to the training functions, because we need not only to cascade knowledge to healthcare professionals, but we need as well to prepare, to make the capacity building on how to use the diagnostics, how to use the referral system between the primary and secondary. And another important point, because we are talking about training, is actually about the retention plans. So we all noticed that moving from the old system to the new system, we do have a better retention in terms of salaries, in terms of benefits, and of course in terms of the working environment itself. The enhanced and standardized quality made the healthcare professionals more at ease in terms of diagnosis, treating, counseling with patients. So having them at ease, it was actually one of the drivers that we are aiming to reduce the migration of the healthcare professionals from Egypt to outside or abroad.
Absolutely, Dr. Islam. Now, obviously, technological support, technological innovation underlines, the implementation of this mega national project, accessibility, like you said, to patients' records, follow-up, etc. How important do you see the use of technology and artificial intelligence in the upcoming stages of the implementation of this project, sir?
So in terms of implementation, and if I heard it correctly, we're talking about artificial intelligence applications and the technology application itself.
Yes.
So recently, recently we are actually relying more and more on the AI in terms of diagnosis, especially in diagnosis. And we've seen that in the radiology field, for example.
Right.
We have implemented, for example, for breast cancer diagnosis, for radiology report writing, the dependence for AI is actually getting more and more. Of course, all of the AI applications still in the pilot phase. We cannot rely on that 100%. Still, we need to depend on human functionability in the hospitals. But in terms of triage as well, we implemented a system for triage. But the most important use of AI is actually in terms of analysis. So we do have a lot of data. And the big data from the healthcare professional, we're talking about 115 million Egyptian citizens. So the big data we do have, it will be easier to implement AI, which is the digitalization step we are currently implementing. Because we need more accessibility to information, not only data. We need to have patterns in terms of diseases. And the patterns of the diseases is actually segmented by AI. It's very important because the allocation of financials for the next fiscal year, for example, will be depending on the incidence prevalence of the diseases we do have. It depends on the age standardized percentages, and all of the parameters of the healthcare will actually be analyzed by AI, and then it will enhance the informed decision making. So yes, it's a crucial step. There is no country recently can actually rely only on the human technology, but we need the AI heavily. We need smart analysis to have a better decisions, especially in terms of allocation of money.
Indeed. Now, Dr. Islam, of course, following up on this, there are upgrades being done to many medical health centers and facilities and hospitals, etc., infrastructural upgrades, machine upgrades, etc. How important is this in line with the development of the health sector as a whole in Egypt?
So we are in the migration phase. So we mentioned during our interview now, like 5 authorities, new one, actually established by 2018.
Yes.
But we still have, and we still got the old system as well.
Yes.
So the migration from the old system to the new system, it means that we do have 2 systems running currently in Egypt. So we are talking about 11 different entities and departments responsible about a lot of things. And this migration requires a lot of collaboration, of smooth governance between all the old and new system. And mentioning the governance, the health governance is one of the main pillars to establish the new system. If we can actually separate the conflict of interest, to separate the double insurance umbrella, the duplications in data, that's the only way we'll be able to do the right migration. And since we mentioned governance, we need to mention automation. Yes. Because we need to automate the system between the old and the new, and between the entities of the new system as well. So, for example, if a new pharmaceutical company, a new diagnostics, even the patients, they don't need to transfer files from an authority to another. And if the patient's actually in one governorate and would like to complete their treatment in another governorate, it will be easily done using the automation and using unique identification, which is the national ID of the citizens. So just one last thing, because we are actually talking about, we need to focus on what will the general public do, Egyptians do.
Yes.
Currently, they just going to be paying premiums. That's it. If they are within the 6 governorates or the governorates that will be added afterwards. And then it will be completely different from the old system. There is no logistics and paperwork like before. They just need to have an appointment using a phone call. There is a hotline, and once there is an appointment, they go to the primary care, and it will be actually taken care of from there. So it will be a very easy process because we actually established the automation in the 6 governorates, not like before they need to go through a hell of logistics to get anything done.
Well, that sounds absolutely wonderful. And on that note, I'd like to thank you very, very much, Dr. Islam Anan, the Health Policy and Health Economics Advisor. Thank you, sir, for your time and your insight and joining us this afternoon on Cairo Local Time.